Celebrex has caused acute pancreatitis, which can be fatal. The use of NSAIDs can also lead to infertility and increased clotting of the blood, which could increase the risk of heart attacks and strokes. Often, even drugs once thought of as safe have been found to cause heart attacks or strokes after years on the market. This is what happened in the case with Vioxx, Celebrex, and other NSAIDs. According to the Annals of Internal Medicine, acetaminophen, which is commonly called Tylenol, overdose is the leading cause of acute liver failure in the U.S. Again, Tylenol overdose is the leading cause of acute liver failure in the U.S. And ibuprofen, also referred to as Advil, can irritate or corrode the stomach lining. It may also worsen kidney or liver disease. Every time a patient takes an aspirin, they bleed internally. A microscopic examination of the bowel movements of daily aspirin takers proved this fact. If bleeding is also occurring in the brain, strokes could be the result. In a study published in Neurology, researchers designed a study to determine how many chronic headaches, such as migraines, are actually caused by the overuse of over-the-counter drugs. The study's results showed in persons taking analgesics on a daily basis for more than 6 months that chronic migraine headaches are more than 20 times more likely to occur. Chronic non-migraine headaches are nearly 10 times more likely to occur, and chronic neck and low back pain are 3.5 times more likely to occur. Surgery is often considered after medication has failed. However, surgery, if possible, should be postponed until other safe alternative treatments have been tried. Surgery versus no surgery? Well, the National Spine Network reviewed more than 18,000 patients suffering with back pain from January 1998 till April 2000. Of those patients, 3,632 had a history of low back surgery. Results showed that patients with a history of lumbar spine surgery fared significantly worse in areas such as physical functioning, general health, and mental health, compared to those patients with no prior history of spine surgery. Previous back surgery is associated with significantly worse general health status than those without surgery among patients with low back pain. A study showed that 70% of those who had back surgery for back pain still report pain 4 to 17 years following their surgery. Another recent study, which included interviews with 197 patients who were due for surgery due to their low back pain, reported virtually no reduction in back pain, even after 1 year following their low back surgery, whereas most physicians had claimed that this surgery would result in a great deal of improvement. Before the study, the doctors were asked to rate their expected degree of improvement in the patient's pain. The physicians predicted that 79% would have a great deal of benefit. The physicians also predicted that 99% would see improvement between moderate and great. A year after the back surgery, nearly 40% of the patients reported no improvement. A review of this study on medicinenet.com stated, "The study is not the first to find that surgery is not the cure-all for low back pain that many patients think it is, or the first to suggest that doctors do a poor job of predicting which patients will benefit the most from back surgery." Orthopedic surgeon Jeffrey C. Wang of the UCLA Department of Orthopedic Surgery stated that fewer than 10% of patients with low back pain are appropriate surgical candidates. Furthermore, he acknowledged that there are probably too many back surgeries being performed. A new drug-free and non-invasive alternative is spinal decompression. The United States Space Agency found that due to weightlessness, many of the early space explorers increased their body height as much as 2 inches during the first 72 hours of weightlessness flight due to increased disk volume. Their height returned to normal within 24 hours following a safe landing on Earth. This important lesson drawn from this experience was that if intradiscal pressure were to be decreased on Earth, it should then be possible to enhance disc nutrition. The key would be to carry this out in a controlled and safe fashion. Researchers at the National Aeronautic and Space Administration, NASA, were among the first to investigate how to produce the same weightless effects here on Earth that are found in space. The decompression system that developed from this research has the capacity and capability of relieving pressure on the spinal nerves caused by disc herniations, degenerative disc disease, sciatica, and posterior facet syndrome. In a study conducted by the Orthopedic Technology Review, 229 patients were randomly selected from 500 patients with a range of different disc diseases, all of which had been confirmed by an MRI. The patients received a total of 20 30-minute spinal decompression treatments. Out of the selected group of 229 patients, 188 of these patients, a full 82%, no longer required pain medication or any further treatment. The following mild recommended exercises should follow any decompression therapy. Double knee to the chest. When you're lying on your back with your knees slightly bent, hug both knees up to your chest to feel the stretch in the buttocks. Side bend. Standing or sitting in a readiness position, slowly bend to one side without rotating. Support the upper body with your hands on your thighs. Feel a stretch in the side of your low back. Short adductors seated. Sitting on the floor with the soles of your feet together, rock your pelvis forward so as to be sitting on your sit bones. While keeping your upper body tall, gently allow the knees to drop toward the floor to feel a stretch in your inner thigh. Trunk rotation. While lying on your back with your knees bent, feet flat on the floor, and with your arms out to the side, roll both knees and your lower body from side to side, holding at each side to feel a stretch in the low back and the hips. Active hip flexor. While standing tall, raise one heel toward your buttocks, grasping above the ankle joint. Keep your knees level, tilt your pelvis, and squeeze the buttocks to extend your hip back slightly to feel a stretch in the front of the hip. Hold, relax the buttocks, and repeat. Exercises should only be performed with the doctor's recommendations based on your specific needs. One key note, remember, stop if it causes pain. I'd like to end this program today by inviting you to receive a gift. Let me explain what the gift is. It's the opportunity to receive, free of charge, a comprehensive consultation and screening. The consultation will help us find what you have done to injure your body. Bodies break down because of injury or abuse. If we can find out from your history the possible causes of your low back pain or why your health has been lost, we can plan a way to recover it. This will be the most thorough consultation you've ever received. It will be followed by a screening to determine if our methods could help you. Some doctors would charge up to $300 for the time we will spend with you. However, I am offering this to you as a gift, which means there would be no charge and no obligation. Let me tell you why I'm making it a gift. It's because I don't want anything to get in your way of finding out if we can help you. My purpose is to help as many people as possible, and I don't want you to have any barrier. To indicate you'd like this gift, please go to the information page of www.nevadachiro.com and complete the email information and include you'd like the free gift, which indicates you would like a free evaluation. There are 4 reasons why you should accept this gift. Number 1, health problems such as low back pain and sciatica can get worse over time if not treated. The second, you will enjoy life more if we improve your health and eliminate your symptoms. Feeling great and being happy is what life is all about. Number 3, I will not waste your time or your money. If I can't help you, I'll let you know and I'll refer you to someone who can. And number 4, you have nothing to lose because I'm going to do the consultation and screening for you